Lung cancer is a growth in your lung that can develop for various reasons, the most common being smoking. Lung cancer is one of the most common cancers and leading cause of cancer deaths in both men and women. In the case of women, it kills more women than breast, ovarian, and uterine cancers combined. We went to PIH Health in Whittier, California, and spoke to Dr. Daniel Saket, who talks about the low-dose CT scan for lung cancer screening.
Evidence has shown is that low-dose CAT scan, low-dose CT scan, is a very effective way to detect lung cancer early at a stage where it's potentially treatable. There was a large national trial recently in the last few years which demonstrated that yearly low-dose chest CT screening can decrease mortality rate, can decrease your chance of dying from lung cancer by or at least 20%. And based on a lot of this data and clinical trials, the United States Preventative Services Task Force recently came out with a recommendation supporting low-dose chest CT for lung cancer screening. So the screening process is very straightforward. We have a nurse navigator who will meet with you about half an hour before your scan and explain the screening process, explain the risks and benefits, and counsel you, and then you'll be taken into the CT room. The procedure is pretty basic. It's about a 10-second scan. There are no IVs, there's no injections, there's no pain involved. Basically, you're placed in a CT scanner, which has a fairly broad opening, so usually there's no issues with claustrophobia or feeling you're in a tight space like you would be with an MRI, for instance. And basically you hold your breath and you move through the scanner, and at 10 seconds later it's done. After the scan is completed, the images get processed. The radiologist will look through the images, interpret the images, and usually there's one of three possibilities. One is that there's nothing suspicious. The second possibility is that there's something that's possibly suspicious, in which case follow-up might be needed, usually an imaging follow-up, or there could be something that's highly suspicious and may require a biopsy. We've put together a team of multiple different specialists, including radiologists, pulmonologists who specialize in lung medicine, lung surgeons, pathologists, radiation oncologists, and medical oncologists. And for every case that does turn out to be a cancer, we meet and formulate a plan that we feel is best suited for your specific case, and we present that to you. The screening is for patients that don't have symptoms. If someone does have a cough or has chest or pulmonary symptoms, it's really important to see your doctor and get that worked up in the appropriate way. This is really for patients that are high risk, that have a significant smoking history and currently don't have any symptoms.
Why are more people being screened for lung cancer today than years ago?
There had never been, up until now, a proven way to decrease your risk other than stopping smoking, which of course is an important part of this. There really had not been a proven way through testing and through screening to decrease your chance of dying from lung cancer. That has changed over the last few years, that this has really been shown to be effective. I think that awareness has been growing slowly over the last 15 or 20 years, but I think we've reached a point where it's pretty clear that smoking is harmful and can potentially kill you. And we're seeing a lot of people that are motivated to try to stop smoking. Along with the screening, we have developed a smoking cessation program, and so this is really for individuals who are motivated to stop smoking and do what they can to lead healthier lives, and at the same time try to do everything they can so that they can live into old age and enjoy everything that we were supposed to enjoy later in life.